Hi, and welcome to the November 2014 Webex on Ebola and pandemic flu. My name is Vera Rasnakam, and I will be the co-host of this training. Along with me today, I have George Medina. George, if you don't mind getting on the call and saying hello.
Hello, everyone.
Great. In this video, we'll review summaries of Ebola, Enterovirus D68, and pandemic flu, including its symptoms, transmissions, best prevention practices, as well as common questions instructors may receive in class. Lastly, we'll review how you will receive credit for viewing this training video. Very much in the news recently, we have the 2014 Ebola outbreak. First, what is Ebola? Ebola, previously known as hemorrhagic fever, is a rare and deadly disease caused by infection of the Ebola virus strain. Currently, there are 5 identified Ebola virus species, 4 of which affect humans, and then the 5th virus causing disease in non-human primates. The 2014 Ebola epidemic is the largest in history, affecting multiple countries, primarily in West Africa. This specific outbreak has a fatality rate of around 50%. Fatality cases in the past have ranged from 25 to 90%. Additional history about Ebola was that it was first discovered in 1976 in the simultaneous cases, in one in Sudan, in East Africa, and the other where it derives its name from, in the tropical rainforest near the Ebola River, in what is now known as the Democratic Republic of the Congo in Central Africa. Since then, outbreaks have appeared sporadically in Africa, with the most recent case in West Africa. This map, credited to the CDC and WHO websites, show the outbreak distribution in West Africa. It is believed that this specific outbreak originally spread by land from Guinea to Sierra Leone, then Liberia. These countries are affected with widespread Ebola transmission in major urban and rural areas. There have been additional cases found in Nigeria due to air travel, and 1 case in Senegal, north of Guinea. There are also locally acquired cases in healthcare workers, 1 in Spain and then 2 in the U.S., as well as 2 imported cases in the United States. Signs and symptoms of Ebola can appear anywhere from 2 to 21 days after exposure. Average time is 8 to 10 days. A person cannot spread Ebola unless symptoms are showing. Symptoms will develop over several days and become progressively worse. Symptoms begin with fever, severe headache, muscle pain, fatigue, vomiting, and diarrhea, developing after 3 to 6 days. Additional symptoms include stomach pain, unexplained bleeding, bruising, and rashes. Ebola can only spread by direct contact with blood or bodily fluids from a person who is sick or has died from Ebola. Additionally, objects like needles that have been in contact with blood or bodily fluids from a person sick or has died from Ebola can also cause transmission. Ebola cannot spread through air, water, or generally by food, with the exception of eating quote-unquote bushmeat from West Africa. This is meat of non-human primates or bats. Additionally, individuals will want to also avoid food or fruits eaten by non-human primates and bats in West Africa. Who generally gets Ebola? Well, people most at risk of getting Ebola include healthcare providers caring for Ebola patients, as well as family and friends who have been unprotected when in direct contact with blood or bodily fluids of a person sick with Ebola. Once the person is recovered, they can no longer spread the virus, with the exception through sexual contact. A question that you may receive in class might be, how do I protect myself against Ebola? Ebola is not spread through casual contact, so chances of transmission are low. If you must travel to an area affected by a 2014 Ebola outbreak or among the risk groups previously mentioned, there are a few things that you can do to protect yourself from the Ebola virus. First, wash hands frequently or use alcohol-based hand sanitizers. When washing hands, do practice good sanitation by ensuring that you're using a paper towel to close the faucet as well as exit restroom doors. Also, you would also want to Avoid contact with blood or bodily fluids of any person, particularly anyone who is sick. Do not handle items that may have come in contact with a person infected with Ebola, their blood, or bodily fluid. Do not touch the body of anyone who has died from Ebola. And if you do come in contact with any of these above items, please do monitor your health for 21 days and seek medical care immediately if you develop fever, headaches, muscle pain, diarrhea, vomiting, stomach pain, or unexplained rashes, bruising, or bleeding. Other questions that you may receive is, how do you know if I have the flu or Ebola? While seasonal influenza and Ebola virus infection can cause similar symptoms, however, influenza is very common and Ebola infections have become exceedingly uncommon. Your symptoms are likely caused by seasonal influenza, but it is not possible to determine this simply by symptoms. Doctors will determine if further tests are needed based on symptoms, clinical presentation, recent travel, or exposure history. A few other points about the flu in comparison to Ebola is that the flu generally does spread mainly by droplets of an infected person with the flu, either through cough, sneeze, or talking. Surface can also become contaminated. Young children, older adults, and people with health conditions can have serious complications. And generally, when flu symptoms arise, they develop within 2 days after exposure and come on quickly and all at once. There are several lab tests used in diagnosis. Once the sample of the patient is collected, tested, and Ebola is confirmed, then the symptoms of Ebola are treated as they appear. Basic intervention, when used early, can improve chances of survival, including IV and balancing electrolytes, maintaining oxygen status and blood pressure of the patient, and treating other infections as they occur are common and basic interventions included. Experimental vaccines are under development but have not been tested for safety and effectiveness. Recovery depends on good supportive care as well as the patient's immune system and response. People who recover from Ebola develop antibodies that can last for 10 years or more. They can also develop long-term complications such as joint and vision problems. For more information about Ebola, please visit the CDC website. The next topic we would like to discuss is Enterovirus D68, also known as EV-D68. Enterovirus D68 is one of more than 100 non-polio enteroviruses. It is a very common virus that causes 10 to 15 million infections in the United States each year, 10 of thousands resulting in hospitalizations. The virus itself was first identified in California in 1962, and symptoms can range anywhere from mild to severe respiratory illness. Mild symptoms may include fever, runny nose, sneezing, cough, and body and muscle pains, whereas severe symptoms may include wheezing and difficulty breathing. Anyone with respiratory illness should contact their doctor if they're having difficulty breathing or their symptoms worsen. Here's another distribution breakout, specifically in the United States, with states confirmed with the enterovirus D68. As you can see, only a few states have been unaffected so far. Since EV-D68 causes respiratory illness, the virus can be found in an infected person's respiratory secretions, such as saliva, nasal mucus, or sputum. The virus is commonly spread from person to person when an infected person coughs, sneezes, or touches a contaminated surface. In general, infants, children, and teenagers are most likely to get infected with the enterovirus and become sick. This is because they have not yet produced and built the immunity from previous exposures to this virus. Children with asthma have a higher risk for severe respiratory illness and should take their medicine and seek further care if needed. Generally, adults can become infected, but are more likely to have no to mild symptoms. The virus can be diagnosed through lab tests on specimens from the patient's nose and throat, and the CDC can determine specifically what strain of the enterovirus or type is in place, such as if it's EV-D68. Prevention for EV-D68 includes good sanitation, good hygiene, washing hands frequently for at least 20 seconds with warm water and soap. Also ensuring that when you do turn off the faucet and exit the restroom that you're using a paper towel so that you're not picking up additional contaminants. In addition, do not touch your eyes, nose, mouth with unwashed hands. If possible, cough and sneeze into a tissue. If one is unavailable, please use the inside of your elbow or upper arm. Also, you want to clean and disinfect frequently touched surfaces or shared items such as cups, utensils, toys, doorknobs, phones, and other items, especially if someone is sick. And lastly, if you are sick, please stay at home. Other questions that you might receive regarding EV-D68 include potential treatment. As of right now, there are no specific treatment or antiviral medicine available for those infected with EV-D68. So if there are any symptoms, please speak to a doctor to help control those specific symptoms. And lastly, what time of the year are people most likely to get infected? Here in the United States, people are more likely to get infected with enteroviruses in the summer and fall. It's expected that EV-D68 in itself will decline by late fall. For more information about Ebola or EV-D68, please contact the CDC website, as well as refer participants, other class participants in the class to the websites mentioned. If there are any other questions, feel free to also reach out to your training specialist. Now, I would like to turn over the presentation to George, who will talk about pandemic flu.
Thank you. I'm going to cover a little bit about the pandemic flu course and end with some classroom best practices and talking points. The pandemic flu program was developed by the Red Cross as a preparedness training in order to discuss the basics of a pandemic and how to prevent it, and also to create a preparedness plan and continuity plan for your community and businesses. The word pandemic actually means a disease that affects the whole world. The last time that we had a major pandemic flu was with H1N1. We can find the information about the pandemic flu courses by logging into Instructor's Corner and clicking the Preparedness tab. There you will find both the pandemic flu for community and also the pandemic flu preparedness program for small businesses. I wanted to discuss some of the classroom best practices, and as a normal, regular starting point for your participants is you want to discuss the health precautions at the very beginning and lay out the rules for maintaining health and safety in the classroom. Let them know that this is your #1 priority as you are discussing health and safety precautions. Usually it may be a few minutes that a student might be sitting in the classroom waiting for the course to start. Have them read over the health and safety precautions. Make sure that you have a handout of the health and safety precautions that you can collect at the end of the class. And also, if they feel ill or look ill, encourage them to reschedule for a later training. Since the course is strenuous, their illness may actually worsen from participating in the course. And if they can't reschedule and you notice that they are coughing and sneezing throughout the course, try to see if you can provide them a separate mannequin to work with and minimize their contact with other participants so that you don't get the whole class and yourself sick. Also, observe participants during the skill. Even if it's not flu that you're looking for or cold symptoms, you may have participants that may feel weak or dizzy or pale, shortness of breath during, say, a CPR skill section. You want to make sure that you have them rest or maybe discontinue the course if they are not feeling well from practicing a skill. Some of the classroom talking points that I wanted to make sure to cover is if they're asking about Ebola and if they're asking about enterovirus, you want to make sure that they visit the CDC website at cdc.gov to get more information. The redcross.org website does have information about Ebola by logging into www.redcross.org/Ebola outbreak. And also, participants can visit the redcross.org website and search for different viruses and diseases that may have been in the news and see what Red Cross is doing to prevent and support the relief of that outbreak throughout the world. There's also information on our First Aid app about these situations as well. Thank you for attending the Ebola and pandemic flu training. The attendance code for this session is COVER. You don't see it here on the screen, but this is the first session of 3 sessions that you will be participating in for the month of November 2014. So make sure to look at the second and third session and put the word COVER and the other 2 words together so that you can send it to your training specialist for attendance credit. Thank you and have a great day.